Alright, so for obstetrics, I want to actually talk about the general physical examination. So the general physical examination is more of like the patient has told you a lot of things, so you want to now physically look out things for yourself. Okay, so this can be what, by inspection, that's just using your eye to observe, then also by touching. Okay, so for general physical examination for obstetrics, things you shouldn't miss out. First of all, it is the initial physical assessment of a pregnant woman. Alright, so it's forming the foundation for trying to identify if any risk, okay, will come up. Then also you are trying to identify that the mother is still healthy, also identifying that the baby is also healthy. Alright, and this could be done throughout that monitoring that is done throughout pregnancy. Okay, so for what we have for the general physical examination, you should observe the general appearance of the person, look out for any signs of what, anxiety, distress, or anything alarming. Okay, then for the vital signs, you try to check out for the person's blood pressure, the pulse rate, the respiratory rate, their temperatures and all. Okay, the anthropometric measurements, you measure their weight, their height, then body mass index. Okay, so this is a bimanual palpation, okay, or bimanual examination. So skin and mucous membrane, you look out for any abnormalities on the skin. Okay, the skin whitish, jaundice, is there too much color, or those linea nigra and the rest of them, striae gravidae. The accumulation of fluid, okay, so you see if there's accumulation of fluid in the face, in the hands, in the legs. Okay, then breast examination, you check out for the breast on two sides, okay, to see if there's any issues on the two sides. Okay, so thyroid gland examination too, you see if it is enlarged. Okay, then the heart, respiratory systems, okay, check out for them if there's any abnormal sounds coming up. In the stomach, you are looking at the size, the shape, and observing if visibly you can see the baby moving. Okay, so also check for surgical scars, okay, skin changes and the rest of them. Right, so these are things you shouldn't miss out on the general physical examination in obstetrics.